Coming up next, we'll talk about how the Northport Medical Center, which is right behind me, will be affected by the Obama administration's health care plan. That's coming up next. The Affordable Health Care Act, also known as Obamacare, is designed to make health care affordable to all Americans so that everyone can have health care. But a lot of Americans do not want it because it will cost some states a huge amount of money to ensure health care to all their citizens. And many Americans are against it because they already have insurance. Ensuring all Americans will cause taxpayers much grief and cause America to go further into debt. So, when the Affordable Health Care Act, Obamacare, comes into effect, what kind of impact is it going to have on your line of work as a manufacturer of medical equipment?
Well, beginning January 1st, 2013, all medical device manufacturers will have to charge an additional 2.3% tax to the dealers on the sale of medical devices.
So, what kind of effect is that going to have on the employees themselves?
Job security is an issue right now because there will be a decrease in sales, which means a decrease in profits.
How is Obamacare likely to impact just American medicine in general?
Short-term effect would be many people who are currently uninsured will become insured. And they will become insured because the government will make them become insured. And if they decide they don't want to be insured, I think they're going to have to pay something like a tax or a penalty for not cooperating. I think a lot of people will have insurance, but they won't have a doctor.
Oh, okay. So.
Isn't that great?
So my next question, that kind of relates to my next question. It was, so basically, because of everyone being able to have access to health care, will it bring in more patients into the hospitals and to the clinics and doctors' offices?
It'll bring in more patients, I think, to the hospitals, because people who might not go to the hospital or the emergency room, they might go, because they would have that coverage. But as far as having a doctor, unless something happens to increase the supply of primary care, they're not going to have a doctor to take care of them when they're in the hospital.
As you can see, there are both advantages and disadvantages to the new health care plan. But as the old saying goes, change can be good, but it is not always best. For the University of Alabama, I'm Ryan Alexander reporting.